Next disease, that is diabetes mellitus, that is DM. So what is diabetes mellitus? Simply it what? It increased a blood sugar level. Yes, what is meant by diabetes mellitus or diabetes? It is a disease in which there is increased or high level of blood sugar. Yes, it is what? It is a group of metabolic diseases in which, yes, what will happen in this disease? In which there are high blood sugar level over a prolonged period of time, for long period of time. Here you can see easily glucose in blood, and see second image, excessive blood glucose. This here it is a normal, and here it is a excessive blood glucose. The symptoms of high blood sugar includes frequent urination, then next increased thirst and increased hunger. If this diabetes mellitus, if left untreated, it may causes many complications. This ketoacidosis, non-ketotic hypersmolar coma, or death. A serious long-term complication includes heart diseases, then stroke, chronic kidney failure, then foot ulcer, and also damage to the eye. Yes, this diabetes mellitus, if it is serious or long term, it may causes or it may result few complications. These complications, it includes heart diseases, then stroke, damage to the eyes, chronic kidney failure, or foot ulcers. Then this diabetes is due to either the pancreas not producing enough insulin, or the cells of the body not responding properly to the insulin produced. I am repeating, see here, this diabetes is because of or is due to either the pancreas are not producing proper insulin, or enough insulin, or the cells of body are not responding properly to this produced insulin. There are three main types of diabetes mellitus. First, that is type 1, second type 2, and third, that is type 1 diabetes, then second type 2, and third gestational diabetes. In type 1 diabetes, here we can see the type 1. In type 1 diabetes, which results from a pancreas or failure to produce enough insulin. Yes, type 1 diabetes or diabetes mellitus, that is DM, which results or in which, or it is because of what? It is because of, or it is due to the pancreas are unable to produce or failure to produce enough insulin. And this form of this type 1 diabetes is also called as insulin dependent diabetes mellitus, that is capital IDDM, or juvenile diabetes. I am repeating, it is also called as capital IDDM, that is insulin dependent diabetes mellitus. The cause of this, it is unknown. Then second, that is type 2. Yes, this type 2, it start with insulin resistance. It is a condition in which cells are failed to respond to insulin properly. Here we can see, yes, this diabetes is start with insulin resistance. It is a condition in which cells are failed to respond to insulin properly. This form is called as, or this type of diabetes is called as non-insulin dependent diabetes mellitus, or it is also called as adult onset diabetes. So primary cause of this type 2 diabetes is excessive body weight and not enough exercise. Yes. So it is primary cause of this type 2 diabetes mellitus, that is first, that is excessive body weight, and second thing, that is not enough exercise. Then third, gestational diabetes. It is a third and main form of diabetes which occur in pregnant women without a previous history of diabetes. See here what I am saying. It is a third type of diabetes and main which occur in pregnant women, without a previous history of diabetes. Here we can compare these features of type 1 and type 2 diabetes. Here for one set, future first, that is one set. In type 1 it is sudden, and in type 2 it is gradual. Then second, age at one set. For in type 1 mostly in children, and type 2 mostly in adults. Then future, next, body size. In type 1 it is thin or normal, and type 2 it is obese. Then ketoacidosis, in type 1 it is common, and in type 2 it is rare. Then autoantibodies, in type 1 it is usually present, and in type 2 it is absent. Then endogenous insulin, in type 1 it is low or absent, in type 2 it is normal, decreased or increased. Then we will, so these are the few signs and symptoms of this diabetes. Here you can see the different signs. In that, first, weight loss. Then second, polyuria, it means increased urination. Then second, polydyspia, it means increased thirst, and polyphagia, it means increased hunger. Yes, polyuria, the meaning of this, it is increased urination. Then polydipsia, it means increased thirst, and polyphagia, it means increased hunger. Then it also includes these symptoms may develop rapidly for few weeks, in week or months in type 1 diabetes, and while they usually develop much more slowly and may be absent in type 2 diabetes. It also includes blurred vision, headache, fatigue, slow healing of cuts, then itchy skin. Yes, blurred vision, headache, fatigue, slow healing of cuts, and then itchy skin. Then prolonged high blood glucose can cause glucose absorption in the lens of the eyes, and which leads to change in its shape, resulting in a vision change. Yes, for prolonged high blood glucose level, it can cause a glucose absorption in the lens of the eyes, and which can cause or which leads to change in its shape, and also resulting in vision or changes in the vision. Then second, a number of skin rashes that can occur in diabetes are collectively known as diabetes dermatomes. Yes, number of skin rashes that occurs in diabetes and which is known as diabetes dermatomes. The next, that is complications. All form of diabetes increase the risk of long-term complications typically for 10 to 20 years. In complication, the major long-term complication, it is related to damage to blood vessels. Yes, damage to blood vessel. Then second, in the diabetes may double the risk of cardiovascular disease. First, that is damage to the blood vessel. Then second, risk of cardiovascular diseases. Then about 75% of death in diabetes are due to coronary artery disease. I am repeating here, about 75% of death in diabetic are due to the coronary artery disease. Then macrovascular disease, for example stroke. Next complication, that is stroke. The next, peripheral vascular disease. Then next complication, the primary complication of this diabetes is due to damage in small blood vessel, or it includes damage to eyes, then kidney and nerve. Then damage to the eye known as diabetic retinopathy, and is caused by damage to the blood vessel in the retina of the eye and can result in a gradual vision loss or the blindness. I am repeating, the damage to the eye, this terminology is known as diabetic retinopathy, and which is caused by damage to the blood vessel in the damage to the blood vessel of your retina of the eyes, and which results in a due to the damage to the blood vessels of retina, what will happen, there is result in loss of vision and blindness. The next, damage to the kidney is called as diabetic nephropathy, and can lead to tissue scarring, urine protein loss, then chronic kidney diseases, and sometimes dialysis or the kidney transplantation. The next, damage to the nerves of the body, which is known as diabetic neuropathy, and which is most common complication of your diabetes. Yes, damage to the nerve of the body, which is called as diabetic neuropathy. The next complication, the symptom include numbness, tingling, pain, altered pain sensation, which can lead to a damage to the skin. I am repeating, next complication, that is damage to the skin. It is because of what? Numbness, tingling, then pain and altered pain sensation. Then next, diabetes related food problems such as diabetic foot ulcer may occur and can be difficult to treat occasionally. Then next, that is additionally proximal diabetic neuropathy. It can causes painful muscle wasting and weakness. So these are the few complications of the diabetes. Next part we will see in next lecture.